Atherosclerotic cardiovascular disease remains a leading cause of morbidity and mortality. Although aspirin is recommended in patients with established atherosclerotic cardiovascular disease, the optimal dose of aspirin to lower the risk of cardiovascular events and minimize major bleeding is unknown. In this open-label pragmatic randomized controlled trial, 15,076 patients with established atherosclerotic cardiovascular disease were randomized to 81 milligrams or 325 milligrams of aspirin daily to compare effectiveness and safety between doses. The primary effectiveness endpoint was the time to first occurrence of any event in the composite of death from any cause, hospitalization for myocardial infarction, or hospitalization for stroke. During a median follow-up of 26.2 months, there was no difference in the primary effectiveness endpoint between the groups, with an event rate of 7.28% in the 81 milligram group and 7.51% in the 325 milligram group. Secondary endpoints included coronary revascularization. No difference in coronary revascularization was observed between the groups, with event rates of 6.05% and 5.96% in the 81 milligram and 325 milligram groups, respectively. The primary safety endpoint, hospitalization for major bleeding with an associated blood product transfusion, occurred in 53 participants in the 81 milligram group and 44 participants in the 325 milligram group, with no difference in event rate between groups. These findings should be interpreted in the context of poor adherence to randomized dose. 7.1% of the participants in the 81 milligram group and 41.6% of those in the 325 milligram group switched doses during the trial. The authors conclude that within the limitation of the high rate of dose switching, no differences in primary effectiveness or safety outcomes were observed between 81 milligrams and 325 milligrams of aspirin among participants with established atherosclerotic cardiovascular disease. Full trial results are available at nejm.org.